Hi, all. From Manhattan, Kansas. It's Sexual Risk and Education Week. On top of the readings and short videos on sex education, as well as the provider video that you have, I wanted to give you a little overview of some of the research on risk in older adults. This is one of the areas that I'm really interested in and do a bit of research as well. So let's get a basic background of some of that information. For the stats on sexual risk, it's a huge issue. It's becoming even more so because we are seeing an exponential growth in sexually transmitted infections in older adulthood. So this doesn't mean that somehow older adults have the most sexually transmitted infections of all age groups. In fact, if you look at a distribution from CDC data, you'll see that older adults actually have the least amount of total sexually transmitted infections for their age groups. However, what it does mean is that in the past few decades, their rate has been increasing more so than other age groups. So we see this rise in STIs among older adulthood, even though they still have a relatively low amount overall compared to other age groups. Still, the teen and young adult age groups are the highest at risk because they have the most risk and most chance to get STIs. However, 17% of all diagnoses of HIV infection among 40 states that report are among those 50 plus, right? And about 23% of 50 states, including DC area, report HIV/AIDS diagnoses. There are 23% of them are from older adults. We see a rise in syphilis, in chlamydia, in HIV among older adults, and this risk or increased risk is one major reason why we focused on the dearth of sex education and the availability of sex ed for older adults. So why is some of this risk happening? You can see from the graph here, but we find that about 1 in 5 sexually active single adults over 50 use a condom regularly. And that would be about 32% of older adult women in the sample and 12% of older adult men. And this is a study done by AARP of about 1,700 men and women over 50. In that sample, about 5% reported having HPV and gonorrhea, 3% reported having syphilis, and 1% of that population, or that sample, reported HIV. Older adults do have lowest rate of condom use among age groups, as you'll see there from the graph. They tend to use it the least. Part of that is because they tend to have longer monogamous relationships, which is not always safe. They also tend to have fewer sexual encounters, especially as we get into older olds. And some of the reasons why in the AARP study they reported not using a condom 4 out of 5 of the times they had sex were because they just felt swept away in the moment. They didn't have a condom handy. They were insulted at being asked. They didn't want to reduce the skin contact or didn't want to reduce pleasure by putting on a condom, or they felt they couldn't perform with one on. So what's interesting here is that when you look at that list of reasons or when you listen to it, pretty much sounds like a teenage boy or a 30-year-old man or woman reporting the same exact things. I don't want to lose pleasure. I don't want to have to ask. I just felt swept away. I didn't have one. I didn't know where to get one. Those are all common excuses among all age groups. We know in particular that older women are much less likely than the younger women to use condoms consistently and correctly. And part of that for older women is something we'll talk about a little bit, which is condom use self-efficacy. So older women tend to not want to insult their potential partners by asking them to put on a condom. They don't want to lose the potential relationship, and they have poor self-efficacy in their ability to negotiate condom use, so they may tend to use them much less. They're just not as confident in their skills or their ability to be able to negotiate that. So we have all of this risk happening in older adults, yet we have providers reporting that they seldom ask older adults about their sexual risk. So similarly to just about sex in general, they ask about sexual risk less as well. And older adults are more likely to perceive HIV or an STI as a stigma than in younger cohorts or generations, and less likely to disclose it to a provider openly. Okay. So some of the things that we know that we need to educate older adults about are both just their general sexual health, so general issues about sexuality, and sex risk specific information. So things about HIV, AIDS, and STIs that are both overall general about that, but also age specific. There's some basic knowledge about age-related issues in STIs, such as when older women lose their principal source of estrogen post-menopause, their vaginal walls tend to thin and they break more easily, which leaves them more susceptible to infection as they're seeing more tears. And also, the immune system as you age tends to be less robust against some diseases and can fight it less. But in general, they also need just basic information about HIV and STIs. So what does the research say about how knowledgeable older adults are about their general sexual health? We can see that they report wanting more information about the impact of their own aging process on their sexual expression, how health conditions affect their aging, and how medications affect them sexually. These are areas of deficit that older adults reported in small studies. Older adult women had very low knowledge of older male sexuality and lacked some basic physiological knowledge about their own sexuality, why they might have reduced lubrication or pain during sex, that type of thing. And we don't find any studies on people providing general sexual information to older adults. We look at sexual risk specific types of educating. So this is the stuff that you'll see, right, when you see the banana and the condom use, or the rates of these types of STIs or transmission types. That's what we're talking about here. And if you saw the beginning slide, I'll just go back to that. If any of you watch Parks and Rec, there was an episode where they were talking about sex education, and they were doing it with an older adult crowd. And it was, in some ways, they were making a little bit of fun, but in a lot of ways, it was an interesting look at how we also need sex education for older adults and how they need that information just as much. Okay, so for sexual risk knowledge, common gaps in knowledge for older adults include different types of transmission methods, how you can get an STI, what types of activities are risky, so maybe different types of oral, anal, digital penetration, all different types. What are the most risky activities when it comes to getting an STI? How efficacious are condoms? That was another area that they didn't know very much about. Again, they didn't know about more age-specific risks, like I mentioned with older adult women and transmission of STIs. The relevance of STIs to them, they perceive themselves to be not susceptible to STIs in a lot of ways. They definitely, when you look at different ethnic and racial minorities, as well as socioeconomic status strata of older adults, there are some groups that are more at risk for lower education and increased risk, therefore, for sexual risk and infection, which includes males tend to have lower knowledge, although some of those results are mixed in the research. African American or Latinos and Latinas individuals tend to have less sex risk knowledge. If you have a lower education level or you have a higher age, so you're into the older olds, you tend to also have less sexual risk knowledge, which again puts you at risk for sexually transmitted infections. I'm going to breeze through this a little bit because some of the The research on this is based on very few small samples, very specific programs that were run, whether it was in older adults that are already HIV positive and they are trying to prevent spreading of the infection, or a very small sample in a very specific region, such as in the South with lower educated, lower SES, small sample of African American older women in a faith setting, so you can get the idea. These studies aren't based on a lot of robust knowledge, but what they do recommend for programs based on that research is that you just share risk information with older adults, so providers should be doing this, and assess their risk. So providers should be assessing risk for older adults regardless of the fact if they're over age 64 and the national recommendations say they don't get an automatic screen. You should be addressing the issues of diversity, which we saw Latina older adults, African American older adults, they're at higher risk for lower education. You can get that direction. In providing culturally competent services, so thinking about the individual, the cultural and values and potentially religious values that they come from, or their sexual orientation or gender identity. Those types of issues are going to affect how you present this information and what you present to the older adult. And plan your delivery of a sex education program around the need. So what are the actual needs? So we know from a little bit of research, right, that I just went over, that there are some areas that are specifically known to be lacking in knowledge and skills, but make sure that you're looking at that specific population and what they actually need, or what their deficits are, and what the barriers might be, like privacy or feeling embarrassed or stigma around certain things. Okay, so what are risk factors for being sexually risky and getting an STI in later life? A lot of these are the same ones, right, that you're going to be throughout life. But the research here would say that, right, lack of adequate sex education is huge. Older adults, especially those middle olds and older olds, those cohorts that didn't receive either comprehensive or any sex education, are going to be at a disadvantage here. They don't know about condom efficacy. They don't know how to negotiate condom use. They may not know how to use a condom effectively. They may not understand that it prevents not just pregnancy but STIs. They may not understand what STIs are, which ones are treatable, which ones are not, and how to transmit an STI, all of those types of things. So there's just a general lack of education. I also want to talk a little bit here about perceived susceptibility. So your perceived susceptibility to an STI is basically, how likely am I to get it? And I want to talk about this specifically because I did a study with some colleagues on a sample of older adults in the United States, and we asked them a bunch of questions about their sexual risk, sexual education, sexual health, and providers. And one of the things that we were really interested to find was, when we asked them about how susceptible they felt to getting an STI in general, the older adult sample didn't feel very susceptible. They much less so than other cohorts. But the interesting thing that we found was that even if their sexual risk behaviors increased, so if we looked at lower risk groups versus a moderately sexually risky group versus a highly sexually risky group, their perceived susceptibility to an STI didn't really change. If you can see those, in fact, went in the opposite direction. So those at lower risk felt, that's correct. Those at lower risk felt the most not susceptible, but those at moderate risk, still 60% of them felt not susceptible. Those in the highest risk category, so having highly risky sexual activities, or frequently, compared to their cohort, they were 65 or 66% of them felt not susceptible at all to an STI, and only 7% felt very susceptible. So at a high risk, you should feel very susceptible. At a moderate risk, you should feel somewhat, the majority of people should feel somewhat to very susceptible. At a lower risk, it should look about like that. But those other two categories are telling us that it doesn't matter how risky you actually are, you don't perceive to be more risky, and you don't perceive to be more susceptible. So there is some misperception of risk behavior there, which begs the question, who is educating them about what is risky and who's asking them about what they're doing that's risky? The other kicker here is that older adults don't get tested for STIs very often at all. We lack screening recommendations from the U.S. Preventative Task Force Services. The recommendations end at age 64. It's another thing for doctors to do and a long list of things with their clients. But how do you know that the older adult isn't being risky and you should be screening them for an STI unless you ask, even annually? Just what types of behaviors? Do you have a new partner? Are you staying safe? Have you noticed any symptoms? Move on. So older adults are not perceiving themselves as risky, even though they are. They're not getting tested for STIs, and therefore we're seeing this rise amongst this population because we're not testing them, we're not educating them, and they don't think that they're risky, even if they are. Okay. So I just wanted to give you a few tools. So if you're thinking about, well, what can we do? What's available out there to help kind of address risk? So we have had some public campaigns, and these posters are examples of a public campaign in the Family Planning Association, which is in the UK. It's kind of like Planned Parenthood for the UK. So this was also on your module page, the male poster, and it says, remember wearing this? So remember to wear this, and it's a picture of a condom. So it's basically saying, hey, you baby boomers, remember when you were silly enough to wear these 70s types of clothing? Well, you should be remembering to wear a condom then, because you're old enough to remember thriving in the 70s, and you need to remember that you still need to be protecting yourself. We also have had some public service announcement type campaigns in the US. So this is a picture here of a YouTube video that was created. It's a Sex for Seniors public service announcement, and they had a subsequent poster made up. But if you Google that or go to safesexforseniors.com and watch the 2-minute video, it's pretty funny. It's just older adults fully clothed, kind of dance into this, club type music, but they're in different sexual positions. So they're trying to raise awareness about the need to be safe in all of these different positions. Another sexual health campaign that isn't quite at the PSA level is from an organization called ACREA. And ACREA is the AIDS Community Research Initiative of America. So they put out this Age is Not a Condom campaign, where they have all of these posters like the one you see here, are different diverse couples, heterosexual, homosexual couples, but they're all older. They're basically saying, remember, age isn't a condom, it's not going to protect you. So ACREA has a great wealth of resources on their site that include things for sex educators, facts about HIV and STIs for older adults and for providers and for sex educators, and some good information in general. One book that, if you're interested in this, that is great, is called Older, Wiser, and Sexually Smarter. And it's by Peggy Brick and her colleagues. And they are sex educators by trade. And they have this book that has hundreds of different sex education activities and topics for older adults. And they're kind of sectioned off in different areas. They include, long-term care, nursing home, topics, as well as topics for LGB older adults. But it's a great resource, and I would encourage you to find it. You can find it on Amazon. I did. But this was just one of the activities that I wanted to show you. So these pictures here, they're images of these cards. And what you do is you cut out all of these individual cards, because these are the steps to putting on a condom. So you distribute the cards either in teams, a set of cards for each team, or an individual, depending on who you're working with. And you have them put them in order for how you put on a condom. And then you go over them, you talk about it, you discuss if there's differences, if you're doing this in a bigger group and you have teams. Why did you have this first? Why wasn't that last? And kind of talk. And then it gives you the opportunity to educate them about the correct succession of steps in order to put on a condom successfully. So that's just one example, but there are several in that book that I would recommend. And that's really it for me for this sexual health or sexual risk week. I just wanted to give you a quick overview of some of the stats about sexual risk, risk factors for sexual risk, reasons why we have an increase in sexual risk among older adults, and some resources for sex education. Sex education is a huge part of this. We have a long way to go. Public health departments are not addressing this. The people who are creating sex education for older adults are few, far between. They're fighting the good fight, but there aren't enough of us out there in a wider audience of people getting these skills like condom negotiation and condom self-efficacy, building exercises, as well as knowledge out to older adults. So this would be perfect for a final project, picking some part of sexual risk or sex education, developing a little program around that. And if you get the book, Older, Wiser, and Sexually Smarter, it could be really helpful for that. So, all right, that's it for this week, and I will see you guys next week.